Part of being an orthopedic oncology specialist involves reconstructing limbs following tumor resections. Sometimes, significant anatomy has been altered or removed along with the tumor, so rebuilding the limb, replacing the bone or joint, advancing or transferring tendons, and repairing or reconstructing ligaments are all part of the strategies used to restore the anatomy and function as best as possible. A natural offshoot of that is joint replacement surgery for arthritis or avascular necrosis. In a similar fashion, when joint surfaces have worn out and the patient is dealing with chronic pain and progressive debilitation, I can provide hip and knee replacements to help restore quality of life and get the patient back to their desired activities without pain. I am one of only a few surgeons in Oregon that offer 3 separate anatomic approaches to the hip for hip replacement, including the minimally invasive direct anterior approach. Each of these approaches exploit different anatomy and carry with them specific risks and benefits that may make one better in a certain patient or circumstance. I can employ modern technologies to my advantage during joint replacement, such as computer navigation, patient-specific instrumentation, and custom 3D printed implants for complex defects or deformities when these additional techniques are needed. Because tumors can occur anywhere in the extremities, and often large reconstructions are necessary, I can provide these same bailout or salvage surgeries when a patient has a joint replacement that goes wrong with things like infection, complex fractures, or catastrophic mechanical failure of their implant. I consider myself a one-stop shop and can help manage all of these problems for patients without having to send them to another surgeon for definitive management. That helps keep them close to home without having to travel throughout the state to complete their care.